1 in 4 pregnancies end in a miscarriage. And because of how we are treating women's and access to women's health care right now, women are actively getting criminalized, essentially, for having a miscarriage. She's going to jail.
Ladies and gentlemen, welcome back to another fabulous episode of the Healthcare Trailblazers podcast. Very excited to be sitting here today with Joy Rios. Joy came across my LinkedIn feed. You seem to be doing a lot of really interesting things. I know you're at Health. You've got a podcast called Hit Like a Girl. Hit Like a Girl?
Correct.
Girl.
Yes.
Very popular podcast. There's some sort of relationship there with health that we'll figure out at some point. You also grew up in California, and you now live in Mexico. So just very interesting. You're doing some cool things in healthcare. Thank you, Joy, for stopping by and spending some time with us today.
Yeah, it is my pleasure. Thank you so much for having me. I am excited to have this conversation with you today, Linda.
Awesome. So let's start with let's go to the middle. Talk to us about growing up in California and deciding to move to Mexico. Fascinating.
Well, okay, so that is a long journey. I didn't move to Mexico until about 4 years ago, and I had grew up in Southern California. I kind of have lived in a lot of different places, and I can list them very quickly. I went to Utah for high school. I came back to San Diego for college. I studied abroad in Wales. I lived in Australia. I moved back to San Francisco. I moved across the country and lived in Miami, Fort Lauderdale area in Florida for a few years. That was my entry into health IT. Then met my then husband, brought him back to California. We lived in San Diego for an additional decade. And then when we divorced, I moved down to Mexico. And part of that is because I had known sitting in the back of my head my whole life that I am eligible for dual citizenship. And I also have a dog that I brought with me. And I basically thought what a great opportunity it would be to sort of have an opportunity to get to know my own country and my own roots in a way that I have never experienced before. And so it's kind of a homecoming in a lot of ways for me. And so since the last 4 years, I've obtained my dual citizenship, bought a home, and as I was mentioning when we first got on the call, I get to watch the sunset over the ocean on a regular basis, and still get to live and work in the U.S. too. So I feel very, very fortunate that I get to experience the best of both worlds.
Yeah, well, congratulations, and that sounds sounds awesome. For some reason, I thought you were going to go all the way and say you got a van and you're doing van life.
No.
You went away, but no, you got a house. You settled down.
Yeah, settled down.
Congratulations.
Yeah.
And how far is it from the U.S. where you're living?
It is not far at all. So it's about 20 kilometers down from the border on the scenic highway. And so if I need to travel in the U.S., which is quite often, it basically, to get to the airport, it's like an hour door to door. So I think a lot of people spend about an hour getting to the airport. It's not that big of a deal.
Basically the same commute if you would live in L.A.
Yeah, exactly.
To go 4 miles.
And I would say that part of the benefit of me living down here is there's a lot fewer distractions. And so when I kind of got really clear about what it is I care about and what impact I want to make and how I want to spend my time and attention, it's really nice to sort of, I feel very connected in a lot of ways, but I also feel very, like I just have the time and the space to focus on the things that I truly care about. And so I think that is what people probably see, the impact that I get to make. And it's a lot because there's not very many distractions.
You know, it's so great you say that, and I totally not just agree, but I've been saying that as well. So I moved to not Mexico, but a quite quiet little nook of northeastern Pennsylvania, and I liken it to, it's kind of like a blank canvas. You know, the relationships aren't saturated, the place isn't saturated, and it's kind of like what you're saying. It just kind of gives you this mental space where there isn't just, like there isn't so much noise and everyone's just trying to vie past each other in like these very superficial, races.
Yes.
I totally agree with you. So I would add, if I could put a beach outside of my window, Pennsylvania, I would do that. But no. So So what are some of those things that you're really passionate about and that you're kind of being able to focus on now?
Well, first and foremost, I do a lot of work in community building and really amplifying the women who work in the healthcare and the health IT space. And so that has become a major passion of mine. And probably from being a little kid, being raised by a single mom and just knowing that women can do everything and being taught from a very young age that, like, self-sufficiency and you're capable and powerful and whatnot. And then I think when I reached into working in the real world and not seeing it reflect that back to me, just felt really disheartening and discouraging. And so I've just been actively, when I wake up in the morning and I think, what impact can I make today? Or that is what is going on in my head. I'm thinking about, how can I be the change or impart some sort of change that I want to see in the world, and how can I show up? And that comes in the form of amplifying others. Comes in the form of having a lot of great conversations and learning and sharing what I learn and writing about it. And a lot of times it's been interesting because it's not necessarily bringing attention to me. It's a lot of times saying, hey, look at this woman, look at how cool she is and how smart she is and what she's up to and the difference that she's making in the world. And I've basically done that like 400 times now. So
It's awesome. Does that mean that you've done 400 episodes of the podcast, or
we've had we've had about 400 guests on the podcast in about 300 episodes. And one of the things that has been really cool is to be able to invite, because the other part of it not really being about me, I'm like, how can I invite other voices that of qualified, incredibly accomplished, and with amazing perspectives, folks to come on and have conversations that they care about, because I can't do it all and none of us should try to do it all. And so that has been really cool in the fact that those folks who have been guest hosts on my show are now starting to create their own podcast. And so part of the growth of Hit Like a Girl podcast is now growing into Like a Girl Media, which I will share you is launching very, very soon.
oh,
To
very
support,
cool.
I know, to support the other women thought leaders in the healthcare and health IT space. And so that, like, it's essentially exponentially amplifying our impact.
Yeah.
Isn't that cool?
Wow. So you're becoming a media platform. Absolutely. Great way to go.
Thanks. Yeah.
Yeah.
And it's interesting. I was having my, thinking in my head of like, oh, I know your podcast is based on value-based care. And I wanted to touch on that of just like, why me? What is it? What do I have to do with that conversation at all? Because I'm in Mexico. I don't see patients. I'm not working in a healthcare setting. But I will share with you a lot of the curriculum, and one of the things that got me into the industry is understanding the meaning. Well, it started out as meaningful use and PQRS, and now the merit-based incentive payment system, part of the quality payment program, where basically I often think of it like health data taxes, where people like clinicians have to do their health data taxes every year and submit their information to the government that helps them identify what their reimbursement rate is. Well, for about 10 years or so, I was the person who was writing the curriculum on that. So reading all of the regulations and the final rules, and then turning that into curriculum where people could then, break it down into pieces that are much more easily understandable than like a 2,000-page rule.
Wow. That's incredible.
Yeah. And so that's part of why I think the podcasting works well too, because I'm able to infuse my knowledge on regulation and how we're trying at least to go from a volume-based system to a value-based system, and what steps are actually involved in that. And my work has mostly been supportive of the independent clinicians and providers, not necessarily hospitals or large healthcare organizations. But it has been really great. It's been nice to be able to find just your spot in an industry and to be able to feel like you make a difference. So
Yeah. So let's talk about those independent docs, because they seem to be ever decreasing breed.
yeah.
It's It's I'd like to say it's sad, but I think it's worth a conversation whether that's sad or not. Um, what are your thoughts on the role of the evolving role of the independent doctor, and what does the future look like?
I think it depends. One, I think independent doctors have an opportunity to have more relationships with their patients, and I do definitely think that that is something that we are kind of missing. And this is off the cuff. Honestly, like this isn't something that I have bulleted points thinking about on a regular basis, but I genuinely believe that when we go to larger systems, I think that some of the details and those details oftentimes our people get left behind. Like, I would love to be able to say that large organizations and corporations are doing things for the best interests of the people who are they are providing care for. But the truth of the matter is that healthcare is a business, and a lot of times they are making decisions based on the bottom line. And the bottom, I mean, take prior authorization, and that's the part that I'm just like, oh, how can we instill that we are really doing right by the people who need it the most, and not necessarily the people who have the best insurance or the most access. And so something that comes up for me a lot is health equity, and you know supporting folks that don't necessarily have easy access to systems. And it's not an easy answer. There's not a good answer. I can see that there's definitely benefit to like working together and sharing resources and collaborating, and I can see why the mergers and acquisitions make sense at scale. And then I also see the flip side of just like, oh, I don't know it folks really who have a great relationship with their primary care physician, or like when we've caught, even though communication is coming in the forms of portal and we should have access to our information, I think there's some sort of heart that is still, you can't really pay for that.
Yeah, yeah. I have so many thoughts on that as well. And I like to say like some of the most successful, most quote unquote efficient, modern, incredible health systems. I think that I think that they are really, really great for healthy people. And like if I want to know if I have strep or whatever, that's exactly what I want. I want to walk in, I want whatever. I don't care who's seeing me. I want to walk in, walk out. I don't care about relationship. I don't care about anything. I want to be in and out in as you know little time as possible and get my paperwork, and that's it, and that's great. But the second the person is not a healthy individual and they maybe have some chronic conditions that they're dealing with, or even a woman giving birth. Like I know, like I've I've got a couple kids, and every time we go through that process, that's where you start really appreciating the relationship and where it becomes really necessary. And I always find it comical when we're in this system that's great and it's super efficient, and but a different doctor sees you every time. And I always find it comical when the doctor walks in and starts giving you advice. And I always just look at the doctor like, why would I like what? There's no credibility built. There's no relationship built. Why
Right.
would we listen to you over anything else? Even or obviously, doctor's biggest annoyance is Google. Don't Google your symptoms. But to the patient, you're the same thing as Google because both have equal credibility. You know what I mean?
Yeah.
Yeah.
And I would say I have two things to share, and just personal experiences. And one was just recently, and I was up in San Francisco. I was visiting my sister and her longtime partner, and the two of us went to Walgreens to go get our shots. I was getting my COVID and a flu, and he was getting uh I forget, but it wasn't either one of those. But he and I have very different healthcare insurances. I actually use the California marketplace. I'm an independent business person, and so that's how I use it. And he works for a very large global law firm. And, you know, I will tell you, his net worth is significantly higher than my net worth. And I had to pay $280 to get my two shots, a flu shot and a COVID shot, that I'm hopeful Kaiser will reimburse me for. And his were free.
Yeah.
And That's the kind of thing.
Through his employer.
Through his
Well,
employer. Yeah, yeah. So, the pharmacy was able to say, "Oh, you've contracted, so it's covered for you." And mine hadn't contracted, so it wasn't covered for me. And I got to tell you, his pockets are deeper than my pockets. Like it and that's
right.
the
I
kind
mean,
of thing.
well, in all fairness, it wasn't free. His employer was paying for it,
Sure.
but the point was he wasn't paying for it and you were, right?
Correct. Yeah.
Um, and yeah, I think there's no. You're obviously. I mean, yeah, the middle class totally gets the worst of it when it comes to healthcare. I'm going through this right now. I have a new company, and we're bringing on some employees, and I have to get them health benefits. And for a small company, it is crazy. I was quoting a family of five, and it would be about $2,100 a month,
Yeah.
a month.
Yeah.
And so, like, for the giant like for a giant law firm, I mean, I don't know what their margins are. And it obviously isn't. It's that times 4,000 employees, so it's still a huge chunk of change. But at the end of the day, for a small business that's trying to get off the ground, or to your point, an independent, just maybe you're one-off person. If you're below the poverty line, then you're good, and if you're way above the poverty line, then you're good. But if you fall somewhere in the middle, it's really really difficult. Really really
Yeah. And so now I also get to experience the relationship because I've started to use some of the health systems down here in Mexico just for convenience. And so I ended up last year getting an x-ray because I was having some lower back issues and trying to figure out and get to the bottom of it. And I had gone to a chiropractor down here, and that chiropractor is the one. I know it's not a typical primary care physician, but definitely somebody that I could see on a regular basis for what I needed. And he was the one who advised me to go get this thing. He's like, I can't figure out what's going on with you. Turns out, my sacrum bone is totally asymmetrical. Like, how would I have ever known that? And a lifetime of like my muscles trying to carry my body differently has like caused me to have some weird back pain. Well, anyway, I took that x-ray and I sent it that very same night because you get it right away here in Mexico. I sent it to him and I put it in my patient portal for Kaiser Permanente. And he called me literally within an hour, not even texted or whatever, emailed me back. He called me and he said, I want you to come in tomorrow so that we can talk about what I'm looking at right here. And when I uploaded it to the patient portal at Kaiser, obviously no response. I had to go through 3 different, and I had to go through a telemedicine visit to then get a referral to see a specialist. And then when I finally did see the specialist, they wouldn't look at that x-ray. They wouldn't
wow.
because the x-ray wasn't taken in their facilities. And so they said, oh, we can talk about your symptoms, which that day unfortunately didn't experience too much, so they didn't have much to respond to for me. And I was like, can I please have the same level of conversation that I've been having with this doctor in Mexico who was like taking this very seriously and
Yeah, good luck.
advising me? And they said, we won't even talk to you about it.
Of
And
course not.
apparently it's a lot. They were like, if you want to redo the x-ray, if you want to go to our imaging center and get it done again. And I'm just like, what is the difference? An x-ray is an x-ray. That's my body. And they wouldn't do it. And there were 2 people in that room. And basically I just never went back. Like,
I've I have so many follow-up questions for you. Okay, so can we dig into your experience in Mexico a little bit more? Because I'm really curious about other systems and something that I love to do on the channel. And if you go to YouTube and you look at our shorts, you'll see a lot of this where I just like my favorite place to go to is just to DC because it's an easy like 4-hour drive for me. And there's so many tourists that I get to talk to people from all over the world. And I'll just go around to like the Lincoln Memorial, the Washington Memorial, I'll just talk to people. Be like, where do you live? How's healthcare there? How's the access? How's the quality? How's the And so I would love to dig into your experience there in Mexico. So, couple questions. First of all, do you have any idea how your doctor gets reimbursed? What the reimbursement system looks like?
yeah, I pay him 800 pesos for an hour-long visit, which is the equivalent, depending on the exchange rate. It ranges between $40 and $45. And so in that 1 hour visit, and it's worth it to me. I
And
get
that's it. You don't have insurance. That's
no, I
basically the
don't. No,
equivalent of a
I don't have
copay in the
insurance
US.
down here. No, I just go in and I just pay for it. And I know the name. So Natalie or Natalia is the woman at the front desk. Dr. Ray is my doctor. And basically, I spend a half an hour with her where it's in a massage table type thing. And she's just like giving me that stimulation, um, also stretching and like focused just like worming and whatnot. And then I go talk to him and I give him an update around like, how am I feeling? Where have I been? And then he basically adjusts me and we talk through any questions that I have. And it's a full on hour. And I feel like I saw him yesterday and I gave him a hug, saying goodbye.
Yeah.
and,
Yeah. I mean, he's
and
your
yeah,
medical care provider. Like, it's an important piece of the puzzle.
and consistently it's the same every single time. I started out going more because when I was going, I had allowed, when I first started, I don't know what this says about me, but I had allowed the pain to get so bad that everything hurt. Like, hurt to tie my shoes, hurt to twist, hurt to put pants on, like everything hurt. I'm like, why did I wait so long? But when I find, so I had been going quite a bit, and then now I just go once a month just to, well, because it feels good, and and I feel
Now, this
cared
is
for.
this is a chiropractor, right?
He's a
So,
chiropractor.
would a local PCP be the same,
Oh
or?
yeah, so there was a time, and it was during the pandemic. I had fallen and I scraped up in a couple of places. I scraped my hand and I got a bruise on my lower back. And it's kind of like a hole in the wall. You basically, it was very strange. It was so different because there's a pharmacy and there's pharmacies all over the place, but then there's a clinic right next to that. And then you go in and then there's a waiting room with a menu on the wall that tells you exactly what the prices are. And so, and because it was pandemic time, there was a one doctor and everybody's masked. One person goes in at a time. And, she bandaged me up and she talked through what it was that I needed to know and then sent me off to the pharmacy. I was out of there and got and of course, no insurance. It was, again, $25.
Now, for you, you work in the U.S. economy, but you live there, so you have that advantage. For locals, is it more equivalent to, like, is that a lot of money for them, or is that also super reasonable?
I would imagine it's relatively reasonable. Yeah, I mean, I assume everything here is like a third of the cost. So people still have to pay out of pocket. And I do believe that there is a program where for insurance and especially the elderly, similar to Medicare. I'm not an expert on this stuff. But that they do have access to hospitals and healthcare and doctors and whatnot, and it doesn't break the bank. People are not, they're absolutely not going bankrupt for healthcare.
Okay, so this is such an interesting conversation. There's a couple primary contributors to the excessive cost of healthcare in the U.S. And from all the people that I've talked to from around the world, I've broken it down to a couple different things. So one of them is the administrative burden, and this is something that you're very familiar with. You worked in, you said, health IT, right? So
Mm-hmm.
the entire, I think the core of it is HIPAA, and then that kind of branches out to just like these really slow crawling, highly, highly, highly regulated systems that end in experiences like you've had where, like, well, this is our EHR, and in order to get your chart from one thing to another thing, it takes 2 years and a bottle of champagne sent to the it's impossible. And so is there the equivalent of HIPAA in Mexico? Or maybe you don't know, but
I have not heard of it, and I will also share that they are using paper. I know for a fact that my chart is on paper, and that if I were to go to any other, they would probably either fax it or call and talk about it. It's like interoperability does not seem to be a focus down here, and so I think that is a huge difference, 100%. And the value of data, like, that is one of the things that we care about. It's like, okay, it's one thing to help an individual, but what if you can see trends that are happening in a region or a larger population? That's where the data becomes really valuable. 100%. It's like, we need that. And those two systems are very different, for
yeah,
sure.
yeah. So yeah, I'd agree with you that that data is not just important, but I think the cornerstone of kind of any ability to evolve a healthcare system. You really want to be collecting that data. So I totally agree with you there.
But how hard hard is it to do both, right? It's just like, it feels like we have to sacrifice one for the other, and there's value in both. It's so hard and complicated.
Right. Well, that's where that's where I think that, and my gripe with this specific corner of the system is that I firmly believe that if you ask anybody like 40 years and younger, if they would opt out of HIPAA for a level of convenience of care that you would expect from 2024, I
Hmm.
think that pretty much everybody would do that. And now a lot of people would be up in arms about like, well, you don't want to be. If what do you mean? Are you going to search me and you're going to see my medical history on the internet? No, I don't think it has to mean the black and
Yes,
white.
I know. Because I think that being a woman, especially right now, post jobs, that HIPAA is actually very important. Where we are coming to in a place specifically for women, where their data can be used against them and actively is being used against them. I'm not sure if you're familiar with the case of Brittany Watts. 1 in 4 pregnancies end in a miscarriage, and because of how we are treating women's and access to women's health care right now, women are actively getting criminalized, essentially, for having a miscarriage. She's going to jail. And that's the kind of thing that it's like, okay, if our data, like that sort of data doesn't, unfortunately, women are in a position right now that their information needs to be protected because it can be used against them.
Well, you
And
could use anybody's information against them, and right now we're in a HIPAA context, and she's still, I don't not familiar with the story, but according to what you're saying, she's still um being being
so let me share with you what happened. So
yeah.
she was past, I'm gonna say she was not, she was maybe in mid part of her pregnancy, and I am not an expert. I'm gonna say she's between 16 and 20 weeks, about halfway through her pregnancy, and she experienced a miscarriage in her own home. She had been going to the doctor several times, and the miscarriage, what she most miscarriages happen in a bathroom, right? And so those bodies, those fetuses end up being flushed down the toilet. And she actually grabbed the stuff out of the toilet and put it in somewhere. What are you supposed to do? It's just like blood and mucus and all of the things, whatnot. Then she took herself to the doctor, to the hospital, and one of the nurses at the hospital pulled out what happened to her and basically called uh, an investigation on it, saying that like what had happened wasn't criminal, but what she did with the remains was criminal. And it's not like there's an easy answer of what you're supposed to do in that scenario. And many people, women in particular, have said that like that is the natural thing. It's not like there's an answer. They end up in the toilet, and it's so anyway. By law, a lot of in many states, a lot of you know fetuses that have been miscarried need to have a death certificate and a ceremony. And so, because she didn't have those in place, she's going to jail.
Right, but my point is that that's and there are HIPAA laws in place.
Yeah,
HIPAA did not protect that scenario from happening.
no, I don't
Right.
think so. No.
Right. And again, I don't think so. So there's obviously like extreme case. Put it this way: if I steal your messages between you and your partner, right? Is that an invasion of privacy? And if I put that out there, is that
Yeah.
illegal? An invasion, of course, 100%,
Yeah.
right? And my WhatsApp they're end to end encrypted. You know what I mean? But at the end of the day, that doesn't impede from your ability to communicate with your partner in a super convenient way, right? So like I think that it's been sold as like this is going to protect your data when on the one hand like what you just shared there's instances where if people wanted to get around that they still will be able to target people even with HIPAA laws in place. And on the flip side, it's still on the flip side if you didn't have it in place that wouldn't necessarily mean that your information is just everywhere. You should still be able to have a really like why don't you own your medical chart? Why don't you own your own healthcare data? Why do you have 6 different charts? One with your chiropractor on Paper Mexico, and one in Kaiser, and one in this system, one in that system, and then you have to convince them by spending hours on the phone to please communicate with each other because you're trying to get something sent over. Why don't you own like your bank account? Like why don't you own your chart and then be able to
Mm-hmm.
delegate access as you wish and you know what I mean? Like things like that. I think we would expect a higher level of convenience in 2024. So
I think you're absolutely right about that. In the same way that we can track our finances and you can say like, oh, there are absolutely software programs that you can connect all your bank accounts and all your investments and all your assets and all your liabilities to figure out like where your spending is and whatnot. We should have the same thing for healthcare. Individuals should have access to that. And I think that they have tried. I haven't seen any that has just kind of made it as like the outstanding go-to
that
one.
gets to my personal belief, which isn't, I didn't overly research this, but if I were some of the larger tech systems, call it Epic, who's been known to do a lot of regulatory what's called regulatory capture type campaigns and things like that. But I think that really what's behind the locking down of healthcare data is the systems that own all the data, because that's how they make money. And if that were to become open source, so to speak, or allow a lot of that real convenient interoperability, that I think that they would lose a lot of market share.
Well, I think you're turning on to something too, which is I think there's a lot of talk from organizations to share data. And then a lot of them, especially the larger ones, are like, maybe you should share your data with me, not necessarily I'm going to share my data with you.
Right. And if you do want to access data, it's going to take, like I'm actually looking into it, and you have to pay like $150,000 a year licensing fee to some mid company that then like connects to them. And then you could technically pay them again to build an integration that they can then accept into their marketplace. Like it is not, hey, how if I request like a Google Docs from you, it's like, do you want to grant access to Mendel? Yes, no, no, it's not like that at all.
No. I mean, as somebody who's performed a significant amount of security risk assessments where you're looking at like, okay, what are the physical, technical, administrative safeguards that are in place? I think that that's important. It is important that the data actually remains safe. But to your point about it being able to get to the people who it belongs to, like the patients, they should absolutely have access to it and easy access to it, not like in the form of what's your fax number or a CD. Who has a CD player anymore?
I remember it was, and it's so, going back to that, just the general cause that healthcare, unfortunately, is so technologically behind. Like I have clients and their billers do not know what an Excel sheet is. They don't know how to open a spreadsheet. Like I'm sending a spreadsheet to a biller and she goes, yeah, I don't, can you fax it to me? And I'm like thinking to myself, like, yeah, let me just hop into my time machine, go back like 10 years, pop out my fax machine and send it over to you. And I'm like, and then she goes, you know what? So I said, you know what? I could do it as a PDF. I could export it as a PDF and send it to you that way. Does that work? She goes, yeah, you could send it to the email. I think I have the email, and my personal, like, my indication for if somebody is technologically challenged is if they use the word "the" before whatever tech platform they're using. So like Facebook or the Instagram, or to me, that's a strong indicator that you might be behind. So I'm like, oh my goodness.
Well, you might know better than me. I'm so interested to know about the generations that are coming up behind us, because they have a relationship with technology that is like far surpasses. I just got invited from a 15-year-old today who has her own podcast and has been coding for, she's already got like a 5-year long resume and she's 15.
Yeah.
And I'm just like, how are these kids, who some of them are so advanced, going to integrate into the system that we have upheld that are historically stagnant? Like we're not seeing progress in ways that you would think that we might.
Yeah. I don't think the system I don't think the stagnation is sustainable. And I think that as much as artificial intelligence has become a buzzword, I do think it's gonna wash away a lot of that kind of crust that's built up around workflows. Because I was saying earlier, there's a couple things that really contribute to the healthcare costs. So the one is the administrative burden, which a lot of that revolves around the locking down of data, because that creates but also the way that doctors and clinical staff are forced to code and to take notes and to document and all that kind of stuff, which a lot of that is going to be gone. And
yeah,
I do think AI is going to force a lot of the change. But to your point, I don't think it is a sustainable system, because the advantage that young people have, really young people, is that 90 whatever % of really young people are extremely healthy. And so they don't really have to interact with the system beyond getting their annuals and, and the off, strep check or whatever, right?
Yeah.
So we have a little bit of breathing room, but I think that in the next 20 years, like 20 years from now, I don't see any scenario where the healthcare system looks like it does now. I just don't.
I hope so. And well, one of the things that also drives me, and I'm glad you brought up AI, is that also the imbalance because AI is trained on our reality and what we feed it. And unfortunately, our reality and what we feed it is also imbalanced. It's very uneven and inequitable. And so part of what drives me is okay, if we are going to be working with AI, how can we make sure that it is not just um, a multiplier of the inequities that already exist? And I say that because I have been working with ChatGPT for most of this year, and it knows very well that I like the name of my company, Hit Like a Girl, and now Like a Girl Media, and all of the things that I'm trying to do. I'm infusing it with, this woman's perspective and trying to amplify that. And now that it has the dolly where it can make images, right? And I say, okay, so podcasters coming together, help me create this image, da 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 da, and it will still be all men. And I'm like, I have to remind, like, remember, this is my audience, this is my business, this is whatever, and it is inherently trained to spit out a perspective that is white male, unfortunately, for better for worse. And so it's like it's an active thing to be able to like, okay, so if that's where we are, then I'm like, oh, my drive is even multiplied because I don't want to scale something that is not supportive of a lot of people.
Yeah, yeah. I think that actually AI can solve a lot of the inequities because the thing that AI does, to your point, is it goes off what it's trained to do. And so it has a mission and it wants to do that, right? Famous example, if you trained an AI model to optimize paperclip production in the world, it would literally figure out a way to turn everything into a paperclip, the entire universe into paperclips, right? Because that's what it was trained to do. And
Yeah.
so I think that ChatGPT's function and obviously some of the primary discussions, especially around health, is making sure that these things happen. But to me, if you choose to build whatever system, AI system, in a way that actually can find some of those inequities and and close them, it will actually do a much better job than we can because it can actually comb through a lot of the data. If that becomes its mission, or not even its sole mission, but if it's like, okay, we want to, for example, in healthcare, right? If the job of this AI system that I'm building is to lower healthcare spend, and that was it, chances are it's going to exponentially increase health disparity,
Yeah.
right? But if its job is to decrease cost while but doing that in such a long term, like doing it in a real way, so essentially while finding those inequities and helping us close those care gaps, then I think it'll do that better than us,
But
obviously.
I would counter that I think that the people who are pulling the strings, and especially large organizations, and I'll even say insurance companies, that their job is to reduce costs as much as possible. And they're not necessarily putting in that factor of like, make sure it's ethical and that we're not doing harm when we're also trying to, for example, the folks that are getting kicked off of Medicare, and because of algorithms from AI. That's the part.
And so this brings us full circle back to value-based care, which is where I think that if we are in a value-based care setting, it becomes my best interest to actually have the preferred patient outcome, which then I don't want to kick that patient off. I don't want to not think about their social determinants of health. I want to think about their social
Right.
determinants of health, and I want to close those care gaps, and I want to find those care gaps, and I want to do it in the cheapest, most effective, way possible because it's in my best interest to care about that outcome. And so that's why I think that the two things together, AI and value-based care, to me, is a really good
I
combo.
agree. And I would love, what is it? Let me see it again.
It's a book I wrote called Unleashing Value: The Case for AI and Value-Based Care.
All
Um,
right. Okay.
yeah,
I'm
and
adding it
it's
to my reading list. I mean, I really do hope that folks that are using AI are implementing the ethical aspect of it, that like making sure that we are interested in patient outcomes and making sure that we are like, that that's what we are solving for.
Yeah.
Of course, cost needs to come into it, but I think the care needs to be at the forefront.
Yeah.
Um,
100%. Couldn't agree with you more. Well, Joy, this was a joy. Honestly, this was an absolute pleasure. I think this was one of the this was definitely a podcast that I forgot that we were recording. To be honest, riveting discussion. I really appreciate you spending time today, and tremendous continued success with Hit Like Girl and all of your many wonderful endeavors.
oh my goodness, there's no shortage of things to do. Thank you for having me, and it's been a pleasure talking to you, Linda.